Imagine a 22-year-old woman named Rachel. She's a bright college student, always on the go. Lately, she's been troubled by a persistent cough. It's especially bad at night, disrupting her sleep. Rachel notices a tightness in her chest, making it hard to catch her breath. Concerned, Rachel decides to see her doctor. He listens carefully to her lungs, noting a whistling sound. To confirm his suspicions, Rachel's doctor orders a breathing test called spirometry. The results confirm the doctor's suspicions. Rachel has asthma. Asthma is a chronic inflammatory disease of the airway that affects millions of people worldwide. It's characterized by inflammation, hyperresponsiveness, and narrowing of the airways, the pathways that carry air in and out of the lungs. This narrowing, often triggered by various factors, makes it difficult for air to flow freely, leading to the characteristic symptoms of asthma. Think of it like this. Imagine your airways are like flexible tubes. In asthma, these tubes become inflamed, like a swollen ankle. They also become constricted, as if someone is squeezing them. This combination of inflammation and constriction makes it hard for air to move through, leading to breathing difficulties like episodes of breathlessness, chest tightness, and cough. Asthma is a complex disease with a variety of contributing factors. It's often a combination of genetic predisposition and environmental triggers. While the exact causes of asthma aren't fully understood, several risk factors increase the likelihood of developing this condition. One of the most significant risk factors is family history. If a close relative, like a parent or sibling, has asthma, the chances of developing it are higher. This suggests a genetic component to the disease. Environmental triggers play a crucial role in triggering asthma symptoms. Common triggers include allergens like pollen, dust mites, mold, and pet dander. These allergens can irritate the airways, causing inflammation and narrowing. Asthma isn't a one-size-fits-all disease. Its severity varies greatly from person to person. Some have mild, infrequent symptoms, while others have persistent, severe symptoms. Asthma is classified based on symptom frequency and severity. Mild asthma is the least severe form. Symptoms occur less than twice a week. Severe asthma requires regular medical care and stronger medications. The inner workings of asthma: inflammation and constriction. To truly grasp asthma, it's crucial to understand its underlying mechanisms. At its core, asthma is an inflammatory disease that affects the airways. When exposed to triggers, the immune system overreacts, causing inflammation in the airways. This inflammation leads to a cascade of events that result in the characteristic narrowing and airflow obstruction. Imagine the airways as delicate tubes lined with smooth muscle. In asthma, the immune system's overreaction causes these smooth muscles to contract, making the airways narrower. This constriction, combined with inflammation, makes it difficult for air to move freely in and out of the lungs. Recognizing the signs. Symptoms of asthma. Asthma manifests through various symptoms, often varying in intensity and frequency. Recognizing these symptoms is crucial for timely medical attention. Classic symptoms include wheezing, coughing, and shortness of breath. Wheezing is a high-pitched whistling sound during exhalation caused by narrowed airways. Coughing, especially at night, is often dry and hacking, disrupting sleep. Shortness of breath can range from mild to severe, often worse during exertion or exposure to triggers. Unmasking asthma. Diagnosis and tests. Diagnosing asthma involves a combination of a thorough medical history, physical examination, and specific tests to assess lung function and rule out other respiratory conditions. The doctor will inquire about symptoms, their frequency, potential triggers, family history of asthma, and any other relevant medical information. During the physical examination, the doctor will listen to the patient's breathing with a stethoscope, paying close attention to any abnormal sounds, like wheezing. They might also check for other signs of respiratory distress, such as rapid breathing or chest retractions. Pulmonary function tests, specifically spirometry, play a crucial role in diagnosing and assessing asthma severity. Spirometry measures how much air the patient can inhale and exhale, and how quickly they can exhale. It helps determine the degree of airflow obstruction, a key characteristic of asthma. Taking control. Managing asthma for a better life. Managing asthma effectively involves a multifaceted approach that focuses on reducing inflammation, controlling symptoms, preventing exacerbations, and maintaining good lung function. The cornerstone of asthma management is the regular use of medications, primarily inhaled corticosteroids, which help reduce airway inflammation. Inhaled corticosteroids are an effective long-term control medication for asthma. They work by reducing inflammation in the airways, making them less sensitive to triggers. These medications are typically taken daily, even when symptoms are under control, to prevent exacerbations. In addition to inhaled corticosteroids, other medications might be prescribed depending on the individual's needs. These might include long-acting beta agonists, leukotriene modifiers, or other medications that help open up the airways or reduce inflammation. Looking ahead. Prognosis and the importance of control. With proper management, most people with asthma can live full and active lives. The key is to work closely with a healthcare provider to develop a personalised asthma action plan. This plan outlines how to monitor symptoms, adjust medications as needed, and seek emergency care when necessary. Regular follow-up appointments with the healthcare provider are essential to monitor asthma control, adjust medications, and address any concerns. During these appointments, the doctor will assess symptom control, review medication adherence, and make any necessary adjustments to the asthma action plan. Thank you for joining me as we explore the intricacies of asthma. Understanding this chronic respiratory disease is crucial for both patients and their families. Remember, knowledge is power when it comes to managing any health condition. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe to this channel for more informative content on health and wellness. Until next time, stay healthy and keep chasing life.